Hello, everyone. I'm Dr. Diana Bitner. I am co-founder and physician at True Women's Health. We're here on our weekly episode of Let's Chat. Tonight, we're going to talk about Let's Chat about headaches. As a matter of housekeeping, next week, because of the holiday week, we won't be having a Let's Chat. And also, we're getting ready for the following week. You won't want to miss this. This is a panel of experts. Dr. Jim Simon. He was named the Menopause Whisperer by the Washingtonian magazine. Dr. Maria Sophocles, she is the expert on Mona Lisa laser touch, who I learned from and will be visiting us in August in person. I'm also excited to welcome Dr. Cheryl Kingsburg, who is a globally renowned sexual health expert from Cleveland, and Dr. Becky Lynn, who is a menopause expert and certified sex therapist from St. Louis. So these are my colleagues and have become dear friends, and I can't wait to bring them all to you. We will all be talking about personalized wellness healthcare and why us women deserve such healthcare by experts who get how women are different than men. And all of us have maybe a different approach, but yet really all believe in what we call gender-specific care or care specifically for women. So again, you won't want to miss the panel discussion on the Wednesday following the 4th of July. And I really welcome you to bookmark that. We've had people having more and more watch parties for these events. How fun is that? And so we look forward to sharing this event, and we'll go from there. Again, tonight we'll be talking about headaches. I want you to feel free to keep this kind of relaxed in the sense of if you want to put a comment or a question. Hey, Linda, if you want to put a comment in the sidebar, then I'll be happy to take that question. If there's something I don't know about headaches, I am not a neurologist, but I certainly specialize in women's health and see a lot of women who have had headaches. And so, again, if I don't know something, we'll answer back. I'll find the answer for you, and I'll get back to you. So tonight, in terms of what we're going to talk about, we're going to talk about why do I care about headaches. We're going to talk about a patient story. We're going to talk about what is a headache, what are the types of headaches, what triggers a headache. Again, those of you who suffer headaches, you're like, okay, I know all that. What is the treatment? So then we'll talk about treatment of headaches, and specifically even talking about during the perimenopause and the menopause. And then we'll talk about 5 tips that I want you to leave this conversation having a sense of or knowing. And then also 5 things that I want you to ask your healthcare provider. Again, you deserve to know this information, and it takes a village. We all support each other. So why do I care about headaches? First of all, headaches are one of the most common cause of anyone going to a primary care doctor with an acute problem and saying, I have a headache. It's more common in women than men. And not only are headaches painful and affect that person in that moment, but can really affect overall quality of life. It's really sad when a woman, again, I take care of women, so I'm going to really focus on women tonight, of course. But, when a woman has a headache, it could take 3 days for it to go away, which she's lost 3 days of maybe her kids' concerts or a family picnic or a work outing. She's missed work, perhaps. And maybe because of chronic headache, she misses out on a promotion at work. The old joke about I have a headache in terms of low sex drive. I mean, having anything like a chronic medical condition of any kind can really diminish sex drive. And if headaches keep us from exercising, it can start to affect our whole ability to avoid heart disease or obesity or diabetes, because if we have pain, we don't want to work out. If we're not working out, it just can, vicious cycle trigger an unhealthy lifestyle. Again, when I think about this, I think about, for example, a patient, Joan, not her real name. And there's so many people like Joan. Joan came to me for perimenopause symptoms, irregular period. She had heavy bleeding and wanted, a solution to that. But also what was happening is that as she was starting to have irregular periods, what happened was that she was starting to get headaches those 3-4 days before a period. And the headaches had never happened before. She had never had a headache, but was getting these in the 3 to 4 days before her periods would start. And once she got her period, it was like, oh, it was such a relief. And so she really wanted to solve for this, because not only are her periods heavy, not only are they irregular and hard to predict, but now she had to deal with this headache. Now, her mom had migraines, and she watched her mother suffer from migraines for years, and she was just petrified that that would be her. She found that, she saw her mom, again, miss out on family events. She saw her mom be depressed or have anxiety or worry that she was going to have a headache. And just saw her mom be a hot mess, and she did not want that. So she came to me wondering, tell me more. So some of the things that I told Joan, we're going to talk about, right now. So first of all, what is a headache? Bottom line, it's hard to really characterize what a headache is. We used to think it was more about blood vessels dilating. It's really not just that simple. It's about activation of those nerves and blood vessels in our head, with the blood vessels constricting and dilating, but it's triggering the nerves and the inflammatory peptides. It's really, when I read articles about different kinds of headaches, it's a lot of talk of peptide this and inflammatory marker that, and it talks about cascading. So maybe it starts low and it cascades through by stimulating nerves to fire. When nerves are firing, they're releasing inflammatory markers, and perhaps because one person genetically makes more of those markers or releases them earlier, there's more of a sensitivity, then that can trigger that headache more in one person than another. And so it's really hard to talk that much about what a headache actually is. It's a little easier to talk about the different types of headaches. So there's 3 main types of headaches. The two are more common, one is least common. One is the migraine headache that Joan likely has. So a migraine headache is characterized by being very throbby. And hey, Nikki, and I miss you too. And migraine headaches are marked by throbbing headaches that are usually on one side more than on both. So it can be on one side, very throbby, and can become very quickly overwhelming. And so when headaches become overwhelming, they can also be associated with being afraid of looking at light. So photophobia, so looking at light, or being afraid to hear sound, that anything would make it worse. The headaches that, the migraines can also be can be made worse if, we'll talk about triggers. But in terms of the headache can be where, when you have a migraine headache, you have to go off to a room and lay still and be quiet and hope for it to go away. And we'll talk about that in the 5 tips. But also, what a tension headache is a headache that is around the head. It tends to be like a tight cap. It tends to be on both sides of the head. And it tends to be something that isn't really affected that much by noise or light. Some people can stay active during a tension headache. Some people can't. And migraines tend to happen and progressively get worse. Tension headaches can be occasional, or they can be chronic and get worse over time. Cluster headaches are those headaches that are just clustered together. They're just terrible, very different from a migraine or a tension headache. And we'll talk about that when we talk about danger signs. So it's, most of the headaches are either a tension headache or a migraine headache. And when we talk about triggers for headaches, they're triggers that you all might know, again, those of you in the audience who have these headaches. For example, dehydration. So for example, when I asked Joan about her seeds, her 7 essential elements of daily success, we asked about water. How much water are you drinking? So she didn't tend to drink a lot of water most days, and especially as she got closer to her period and didn't feel good, she sort of went down on the self-care. She would eat more sugar. So sugar can trigger a headache, either high blood sugar or really low blood sugar. Stress definitely can trigger. And again, stress is such a cloudy, nebulous term, right? What does that even mean? Stress can be the fact that your muscles feel tight and you're holding your shoulders tight because you're stressed and you're typing at work. Stress can be also related to the immune system, and it can trigger an easier response to a pain or you have a tight muscle and it triggers response to pain and shoots and crescendos into a major headache. And so stress can be a cause. Wine can be a cause for some people. Some people think it's the sulfur. It could also be the sugar. That definitely can be something. I have a whole list here. For some people, it's chocolate. It can be aged cheese. It can be aspartame. For some people, it can be caffeine, but yet sometimes caffeine is a treatment for headaches. With hormones, what happens when a headache is triggered, especially a migraine, the headaches are triggered not just by the steady state of, let's say, estrogen, but it's triggered by sudden change. So let's say all your life you haven't had menstrual migraines associated with your period, but as you get closer, like Joan, to menopause, what happens is the hormones aren't just so smooth anymore. The hormones go up until ovulation, take a little dip. So some people will have a migraine right at mid-cycle, and then the hormone levels kind of are a little uneven and then might drop right before a period suddenly. It's the rapid drop that can trigger that migraine. And I can't say that we know a whole lot about the exact cause of that trigger. Is it that there is blood vessel dilation? Again, that's mostly been debunked, but could it be part of that? And then the nerve releases then the inflammatory peptides, the pain factors, and then the headache just goes from there, and it takes a while to pull back. We do know that we'll talk about it, but treating with a low dose of extra estrogen right around that time, I like to say, to stop the drop. And then sometimes that little bit of estrogen can help that migraine headache not happen. Other things can be weather, like environment stuff. So like weather or travel, crossing time zones, seasons, altitude. Again, we talked about blood sugar, but the environment of dieting or skipping meals. There's good data about intermittent fasting that it can help reset your metabolism. But on the other hand, with that really low blood sugar, can that be something that also then triggers a headache? Hey, Wendy, how are you? So again, if you guys have any questions, please feel free to chime in. So again, when I talked to Joan about these triggers, she was able to start thinking about, oh, maybe I can get some sense of control over this by understanding what those triggers are. And so for her, she worked in an environment with lots of cubicles and lots of busyness and lots of noise, and wondered if that was maybe a part of it. There was a lot of fluorescent lights. Sometimes certain lights or stimuli can trigger a headache. Sometimes seeing something like someone wearing a striped shirt with really tight stripes, sometimes just a certain visual stimuli, or being in a building with a fire alarm goes off, that can trigger a headache. Again, it's so confusing yet, but it's so important to understand what your trigger is, again, to help avoid that and hopefully avoid a headache. Again, when we look at treatment options, it's really important to understand, number one, avoiding triggers is a really important part of treatment, but then also to think about, is it a migraine or is it a tension headache? And that can affect what we look at as treatment. When we talk about a tension headache, the first thing that we might think of is the simple over-the-counter pain medicines, like an aspirin versus ibuprofen versus naproxen. Any one of those non-steroidals can be effective, but unfortunately, as the headaches become more frequent, they become harder to treat, with those medications. And sometimes then overuse of those medications becomes a real challenge in terms of when you go off the medications, it can trigger a headache. So it can become, with those frequent headaches, it can become very difficult to really get a good treatment plan. So again, it's so important to understand the triggers and how can we not get those headaches to even start in the first place. It can be, the treatment then can also then involve stronger medications in the non-steroidal family that are prescription. And then it can move on to, narcotics. Now, again, with narcotics, there's so many downsides of addiction, of overuse, of when someone goes off narcotics, it triggers a headache to come back. And so that really is not something that's looked at as something that we go to anytime soon. And so it's really to focus on avoiding the headache and then treating hopefully with low-dose nonsteroidals. Now, again, when we talk about a tension headache, again, isn't always triggered by tension of muscles, but again, we know that it's often triggered by the muscle and the fascia with again, tight neck, tight muscles. And again, who of us always stretches as much as we should? Who always, is staying as active as we should? So truly, there are so many factors from how we hold ourselves, how much we exercise, how much we stretch. So again, there are physical therapists who focus on those myofascial touch points, who work with really helping you understand your body, and then applying different therapy, different manual therapy, massage, and more advanced forms to really move through that and release that. I see, I have a question. Are migraines more common after menopause, or it is more with perimenopause, premenopause? So Nikki, it's more common with perimenopause, because as the cycles change and the hormone levels fluctuate, then that can trigger a migraine. All of those other things that happen associated with perimenopause, let's say more hunger for carbs. A lot of women in perimenopause, especially with sleep deprivation, will crave more sugar. And so when you crave more sugar and you eat it, your blood sugar goes up and then it drops. That triggers a headache at the drop. And so it could be sleep deprivation that causes that headache. So I would say they're much more common during perimenopause. But then after menopause, or especially if you've been in menopause for a long time, and then it's looking at all those other factors like crazy stress, sleeping in a new place, not always having a schedule to eat regularly, being busy and stressed at work. All of that can then cause, no matter when you're in menopause, those factors then become more of an aspect. But again, with perimenopause, it's more that fluctuation of hormones that causes an issue. And again, Joan, the patient that I was talking of initially, she walked in the door saying, my periods are irregular. I went 2 months without a period at one time, so we know she's in late perimenopause. Now that she's in late perimenopause, her hormones are going to potentially even be more erratic. Well, she'll ovulate, and then for 2 months she doesn't, and then she does, and then she doesn't. And so not only are the hormones fluctuating, but again, the lifestyle habits and the results of that are fluctuating. So again, back to treatment options for tension headaches. It's non-steroidal or pain medications that help with the inflammation. And again, I want you to think about how they work. So non-steroidal is something like, again, Advil, Tylenol, ibuprofen. What those medications do is they reduce the inflammatory response. And we know that the headache spreads with that inflammatory markers, or those inflammatory, essentially, chemicals. And so it's really important then to reduce the production of those. And so we can then treat that headache. The migraine headache can also be initially treated, especially if we catch it real early, like it's just starting and we can catch it. If it's a mild migraine, which many people with migraines would say there's no such thing, but sometimes just really being in tune with those triggers, avoiding the triggers such as sleep deprivation, dehydration, unfortunately, maybe avoiding wine as a drink of choice, avoiding high sugar, low sugar, but then also the minute that migraine happens, drinking a ton of water, sometimes even having a cup of coffee or a caffeine source of caffeine, whatever it is, matcha tea, or even taking a medication that has, let's say, Tylenol and caffeine in it together. That caffeine can help constrict that blood vessel. At the same time, the medication reduces inflammatory factors, and it can hopefully stop that headache from progressing to worse. Migraine headaches are also treated by something called a triptan, and a triptan is something that can also reduce that inflammatory vascular response, and the sooner they're given, they can help stop that headache right away. Sometimes people will take medications that are used to lower blood pressure. They'll take those medications every day to help those headaches from ever coming. But unfortunately, there definitely can be side effects such as fatigue and less motivation to exercise. But for some people, it's a lifesaver. Again, narcotics are very rarely used in headache management because, again, we worry about dependence, we worry about side effects. And I know for some people, it's like the one thing that really can knock them out. But long term, just again, we always have to talk about the risks versus the benefits of a certain treatment. Again, I keep going back to triggers. If stress is a trigger, if there's been I had a patient with recent very stressful events and it's triggered her migraines back again. So it's really looking at how can we address the triggers and meet them head on and, do our best to treat it as it starts. I just wish there were an easy answer for headaches. And again, it's such an individual thing. In terms of other treatment options for migraines, I have a patient who requires steroid infusions when she gets a really bad migraine that will just not go away. So she'll get it where it's on one side, it feels like there's a knife in her eyeball, it just will not go away. Extreme sensitivity to light, extreme sensitivity to noise, and she has to go into the infusion center and actually get an infusion of steroid, which reduces that inflammation, and that's the only thing for her that will stop the headache. So it's, at least now she knows. And again, her headaches got so bad that she needed that referral to the neurologist, and the neurologist would then be involved in offering that level of treatment. What's really important for you to know are, what are the danger signs for a headache? So a danger sign for a headache could mean that it's a reason that we need to do some imaging, let's say a CAT scan, to look inside and make sure that nothing is more seriously wrong. So again, you've all heard me say the number one thing is I want you safe. So I want you to know when there's an issue that's more than just your hormones. So it's important to know those danger signs. So I don't want to miss anything. I have my little list here. So, you know, there's an acronym we learned called SNOOP 10, but the danger signs of a headache would be if it's consistently with a fever, if it is associated with, you know, a history of cancer. Heaven forbid that someone's had cancer, and it could be a sign that it's come back. I even hate to say that, but again, if you've had a history of cancer and your headaches are getting worse, it's really important to use that as a reason to have imaging. If you have a neurodefect, what that means is that you're also having, let's say, paralysis, like you have a headache and your arm goes numb. We've got to look at that with imaging and get you in to see a specialist. If you're over 50 and you have new onset headaches, that's definitely a reason to do imaging, for example, a CAT scan, maybe even to have you see a specialist. If the headaches are worse with position change or sneezing or, you know, increased pressure in the brain, it's important to make sure there's no other cause of higher pressure, you know, in the brain. So again, that can involve a CAT scan. It could involve a lumbar puncture, which is releasing pressure from the spinal canal. And again, that's done by the specialist, by the neurologist, but that would be a reason. Pregnancy, if you're pregnant and you get new onset headaches, you know, the number one thing we worry about is pregnancy-induced high blood pressure, and associated headaches can be a sign of preeclampsia. And so if you're pregnant and have headaches, it's definitely something you need to talk to your doctor about. It could be a migraine, but it could also be associated with more serious conditions. If you have an autoimmune condition or an infection such as HIV, having headaches can be something that needs to be looked at by the specialist, again, with imaging. The other thing is painkiller overuse can be an issue. So I had a patient who had a frozen shoulder. She used a ton of Motrin, and she used it for so long, so frequently to deal with her frozen shoulder that whenever she'd go off it, it would trigger a headache. And so I can't tell you that I exactly understand that mechanism, but for her, it was important to slowly wean off that Motrin, to have other options. What I didn't talk about with migraines is also using anti-nausea medicine. So it's really making sure that we understood her situation, helped her wean off the Motrin, deal with the frozen shoulder, and then get her headaches under control. So again, why I care about this is because headaches can be confusing. They can be very debilitating and interfere with life, but then they're also, you know, we've got to get on top of it and get the village around. Another question I often get is, when do I know if a headache is dangerous in terms of risk of stroke? So the type of headache that's maybe more associated with risk of stroke, and I ask every patient about this when we see them, is your headache associated with aura? That's certainly important, but the aura that's more indicative of risk of stroke is what we call retinal aura, or where actually part of your vision is blocked. And we know that really is generally caused by extreme vasoconstriction back in the visual center of your brain. And with that extreme vasoconstriction, again, stroke is very rare with a migraine, but it could increase the risk, especially if you're taking a synthetic oral estrogen. So let's say that you have retinal aura. I would not recommend the oral contraceptive pill for birth control or management of perimenopause, especially if you're a smoker. So if you smoke cigarettes, and have a visual migraine where you have the aura, where you lose part of your vision, I would so encourage you to stop smoking. If you can't stop, at least way reduce it. Look at all your other risk factors and triggers. If you're on the birth control pill, get off, find another option, which we're very comfortable talking about other options, and really make sure we protect your brain. And so we see that as definitely those danger signs, those auras where you actually lose your vision or even have tunnel vision. So for example, patients who have those visual auras, we are very careful in terms of what kind of hormone replacement therapy we use. And for some patients, the risk of stroke is so high because of imaging that they've had, the recommendation of the neurologist, maybe hormone replacement therapy is not an option. Again, it's really important to know those danger signs, and number one, to keep you safe. So what I want to move into next, again, is the 5 tips that I want you to take away from tonight. So as we think about, for example, for Joan, the first tip is I want you to think about your headache, think about your process, think about your triggers. So for Joan, she had not only the menstrual issue in terms of her periods were getting irregular, her estrogen was dropping quicker, but that was the time of the month that she didn't feel as good. She didn't drink her water. She didn't get her sleep. She, sorry, my phone ringing. She didn't get her sleep. She, again, would eat more sugar. She was more stressed out. She had PMS in terms of mood stuff. So because of that, then, she might get irritable with the family and get into spats in the family. So there was more stress on top of her menstrual changes with the hormones. And so it's really understanding your process, thinking about the timing of that headache, and then really understanding how to avoid those triggers as well as to, be on top of them when they happen. And so we were able to kind of tease that apart for her, and we were able to get a plan based on her knowing her headache triggers. Tip number 2, again, is map the timing. And so she was very aware that they happened 3 days before her period started. What that allowed me to do is, number 1, as we got her triggers under control, it was a way that we could maybe consider an option of a very low dose hormone patch, an estrogen FDA approved hormone patch that she would use the second she got to that timing, and again, it can be hard to tell with perimenopause, but she had other symptoms, bloating, craving. She knew when it was going to happen. She would put the patch on. The patch lasts 3 days. It would stop the drop, and she would avoid the headache. And again, it was that she also was avoiding the other triggers, but she was able to use that little bit of estrogen to stop the drop and avoid the headache. Number 3, it's going back to the basics. And so we talk all about seeds and MTS. So seeds, you've heard me talk about the 7 essential elements of daily success. And it all goes back to that. Water, are you getting your 80 ounces? Sleep, are you prioritizing sleep and getting your 7 hours of sleep? Are you having a good balance of healthy carbs, healthy protein, healthy fat, and then limiting that treat to 1 treat per day, either a white hot dog bun or chips or a glass of beer or a treat like a brownie? Not all of them, just 1. So again, if we can limit our sugar, eat really healthy, are we exercising? Are we providing ourselves with self-care? And then do we have the gift to be able to go to metered breathing, to go to meditation when that happens? Can we use our seeds to actually avoid a headache, but hopefully shorten it or at least make it less strong when it happens? The MTS, the Menopause Transition Scale, is a way to track your menopause transition symptoms. So these are symptoms that can start as early as 42. For some women, they can go a couple years, 5 years past menopause, and then even then some. But as we track our symptoms, then we're in charge of them. We can become in charge of them. They're not necessarily in charge of us. They're not confusing. We know what they are. We know when they're going to happen, and we can make a choice about treating them. So is it hot flashes and night sweats? So for example, do you have a night sweat and the next day you're going to have a migraine at work? So again, it's tracking those symptoms as related to your perimenopause or your menopause process. Are you having decreased libido? Is that from hormones? Is that from aging? Is that from self-image? There's 27 reasons for low sex drive. and we want to make sure that headache is not one of them. We also look at, again, vaginal bleeding. Is bleeding heavy? Is it frequent? Is it spread apart and then surprising? So again, knowing your menopause transition scale is a big deal and really, really powerful as a tool. If you choose to be a patient at True, we have a True app that allows you to track your symptoms and track your habits. And very soon, the new version of the app is coming out that will have the symptoms and the habits on the same screen. I can't wait to use it and to see it. It will be out soon, and we'll be able to track it on the same screen. And so you can see, oh yeah, hot flash, headache. Okay, now I know that they're related. So we're really excited about that. Number 4, don't be mad at me when I say this, but I want you to think about, what is the gift of a headache? How can the headache be a gift? You know me to be a glass half full kind of girl. I'm always looking for the positive side, right? But sometimes headaches can really be a sign. Sorry, here's my cat. So headaches can be a sign that there's something that I didn't really think is a stressful situation, but you know what? I need to address this. Whenever the situation happens, then I get a headache. I'm not sleeping enough. When I'm sleep deprived, I get a headache. Boy, I really need to prioritize my sleep. I'm really not taking care of myself, and I'm just eating not healthy food. I'm eating chips and hot dog buns and, white bread and brownies and too much alcohol. All of that can create a headache. And so I would like you to think about, okay, headache is a gift. It's telling me I've got to get my act together before this gets out of control. So yes, headaches can be gifts, but we got to help you get rid of them with all of that thinking. Number 5, I want you to have a plan. So if that headache happens, I want you to know what's going on. And again, in perimenopause, they're going to happen more with irregular periods, but also not drinking your water. So have a plan, be prepared. Bring your water with you when you're at work or when you're traveling. Make sure that you've got healthy snacks in your purse, like some Triscuits and a cheese stick. Be prepared so you don't get stuck with low blood sugar, dehydration. Oh, geez, my period's starting. I'm at work and I'm supposed to go give a big presentation. You could have avoided that if you had a plan. So we're here to help you get a plan so you can be in charge, not your headache. I now want you to think about 5 things that I want you to ask your healthcare provider. Again, you deserve to have the answers. You deserve to have good treatment. And so the 5 things that I want you to ask your healthcare provider include, number 1, what is my phase of ovarian function? You hear me say this a lot, but I believe every woman deserves to know, what is her phase of ovarian function? So let's take someone who had an ablation. They had the lining of their uterus burnt, so they wouldn't have to have heavy periods. They don't have any periods. So now all of a sudden these headaches come out of the blue, and an occasional hot flash, and now worse PMS. Like, what is going on? We can do look at the history and also do a blood test to get a sense of, where are you in your phase? Are you in menopause? Are you in perimenopause? If a woman's had a hysterectomy, but she still has her ovaries, it can be confusing as well to know. I've had patients whose mother had a hysterectomy. She didn't know when her menopause was. She doesn't have sisters. She's not close to friends that are at her same age. So she doesn't know what's happening or what's going on. And so it can be very confusing. And your healthcare provider should be able to help you figure out, what is your phase of ovarian function. And if you're listening to me from far away, you can go to the website menopause.org and find a certified menopause practitioner in your area. So there are 1,200 certified menopause practitioners in the United States, in Canada, and in Mexico. And so we're around. So you just have to look for us, menopause.org. Number 2 is, I want you to ask, what type of headache do I have? Do I have a migraine headache? Some people come to me and say, I've had migraines forever, when actually they have tension headaches. Cluster headaches, you definitely know if you have cluster headaches, and so will your doc. But sometimes knowing what kind of headache, again, can help guide what kind of treatment that we would recommend. And so it's really important to ask that question and make sure that you are real clear with what you've got. Question number 3, again, is talking to your healthcare provider about those triggers. I listed tonight a partial list of those triggers, and we'll have those in the blog that we'll post soon. But it's knowing those triggers and talking to your healthcare provider, because they might say, yes, I saw a patient with, or yeah, let's look that up together. Maybe you have a trigger that I'm not aware of as a trigger. Let's sit down and talk about that. We have a lot of resources as healthcare providers, including a search engine called UpToDate. So we can look up, what is the latest data, and maybe there's some new information out that I haven't heard. So I want you to sit down and have that conversation with your healthcare provider to discuss those triggers. Number 4, what are my treatment options, and what are the pros and cons of each of them? So are there prescription options? Are there options that I can get over the counter that I haven't thought about? If I travel, I'm really anxious that I might get a headache, can I have a prescription, let's say, for an anti-nausea medicine, which sometimes can help knock out those symptoms that go along with a migraine of nausea or vomiting? Can I take a pill with me as I travel so I don't have to worry that that's going to happen on an airplane when pressure changes? So again, it's really understanding those options and having that available to you. And, it's also then not only prescriptions, but when is a referral needed? So if I need a referral, am I making sure that I know how to get that? Does my healthcare provider know when to refer, where to refer, and how is that going to be organized for me to make sure that there's good results from that referral? And then tip number 5 is, who do I call if it gets out of hand? If the headache comes on and it gets worse and worse, is there a doctor or a nurse practitioner or a PA on call? And when I call, how can we help figure this headache out so we can get rid of it at the time? Again, it's all about having a plan. So headaches can be very debilitating, very stressful, and it's all about knowing what to do when we get a headache. So tonight we've talked about what is a headache, and which can be very hard to define other than pain in the head, right? So it can be hard to define, but we know it has to do with inflammatory factors and muscle and fascia and everything that then spreads up into our nerves in our brain tissue to cause that headache. And so we've talked about what is a headache, what kind of headaches exist, what are the triggers, and what are the treatment options. And then 5 tips to take away and 5 questions to ask your healthcare provider. So I appreciate your attention to this. If you have any questions after the fact, please don't hesitate to put them into the Facebook comments and questions. Go to our website at truewomenshealth.com, or we'd love to see you at our True Women's Health Clinic, and we'll help you within our specialty. We'll help you as much as we can. If you have headaches that don't make sense to us, we have great people that we can refer you to, including physical therapy, including primary care, including neurologists, and we work together as a team to get your symptoms under control. I wish you a great evening and good health. Thank you.